Good morning everyone. Today we are going to discuss about first aid. First aid means I think everyone knows what is first aid and what is the purpose, why we will do first aid. So today we will learn about this topic in detail. Okay? First we will see the definition of first aid. So first aid is the first assistance or aid or treatment given to a patient in emergency situation before going to a hospital. Means first aid means it is the treatment which will provide to a person before going to a hospital. So we can say that if the person is injured before going to hospital, we will give the treatment, that is first aid. Next we will see the purpose of first aid, why we have to give, what is the use of giving first aid. Okay, first point, to sustain the life of a person before the arrival of a qualified medical staff. If accident happen, example, if any accident happen, so before arrival of ambulance, it will take some time. In that time we have to give some treatment, so by that we can save the life of a person. That is the first purpose. Next, to reduce discomfort due to pain, so we can give any medicine or any applications like giving ice packs, like that. By that we can relieve the pain of a person. Next point, to early recovery and prevent his or her condition from worsening. So by giving first aid we can recover the patient. Okay. Next we will see the principles of first aid. So while giving first aid, what principles we have to follow? What are the principles we will see? Okay. First one, preserve life. Next, ensure protection of the casualty from further harm. Provide pain relief. Prevent the condition from worsening. Okay, first we will see preserving life. How we have to preserve the life of a patient. This includes preserving the life of the casualty. Casualty means patient. So by giving first aid we can preserve the life of a patient. Next, second one, ensure protection of the casualty from further harm. By giving first aid treatment we can prevent further harm to the patient. Okay, like complications, anything. Okay, by giving first aid we can protect the patient from further harm. Okay, we have to see that while giving first aid there should not be a gathering. Okay, gathering అనేది ఉండకుండా చూసుకోవాలి, because patient may get suffocation or anything. So we have to see that that treatment area needs to be safe and must not have excess people. Next, third one, provide pain relief. It includes the use of ice packs. Okay, ice packs or any pain relief tablets. Okay, we can give any medicine to reduce the pain. Prevent the condition from worsening means ensure that the first aid procedures do not worsen the patient condition. Okay, first aid means we have to give just first aid treatment, which will include just first aid, means it should not affect the person. Next we will see the rules of first aid. We have 3 C's. 3 C's means check, call, care. Okay, we have to follow this. Check means find out what happened, what is wrong with the person. We have to see the person first, what happened, how it happened. Okay, we have to check. Next, call, arrange for a professional medical aid. First, after seeing any emergency situation, first we have to call 108, then we have to give first aid treatment. Meanwhile that ambulance will come. First we have to call for any emergency 108, like that. Next, care, help the victim preferably without moving her or him. Okay, while giving first aid treatment we have to see the comfort of the patient. We should not move here and there, because it may harm to the patient. in case of fractures, we should not move from the one place to other place because it may displacement of bone will happen and it will harm to the patient. So we should be care with the patient. Next we will see the facilities, equipment and materials for first aid. So what all are the facilities we have to see, what all are the equipments and materials for first aid. Okay, what it contains, first aid kit means what it contains and what all are the equipments we need for the first aid. First we will see the first aid room. What is first aid room, what it contains. So first aid room, it is the place where equipment and materials are arranged systematically for providing first aid services. First aid room means it is the place where equipments and materials arranged systematically for providing first aid services means this room includes only the equipments and materials which will help for the first aid treatment. Okay. This room must have following. What all are the nameplate with the symbol of first aid. Okay, first aid room, like that we have to keep one nameplate for the room. In hostels also we are observing, in every educational institutions we will be seeing first aid room symbol. Okay, labeling. Okay, we have to keep the nameplate with the symbol of first aid. Second one, adequate lighting and ventilation. That room should have adequate lighting and ventilation. Next, toilets which should be friendly for different abled persons means we have to see that room should have toilets, different toilets means western. There, if the person is having any physical disabilities, they have to go comfortable, so we have to see different toilets should be available there. Next, facilities for the easy movement of a person on a stretchers or wheelchair. So we have to keep stretcher means I think everyone knows. Okay, we are observing in hospitals now that patient will be sitting and we have to shift from one place to other place means we will use these stretchers and wheelchairs. So we have to see that room should be having stretchers or wheelchair. Next, table, chair, telephone. Okay, telephone means if any emergency means we can call, so that purpose we will use telephone. Table, chair, common. Okay, next, first aid kit. First aid kit means it will be having different types of medicines or emergency chemicals, like that. Okay, next, portable screen. Screen means I think everyone knows that green color screen will be available in hospitals. No, that should be there in first aid room. Next, container for storing sharp items like surgical knives. One container for keeping the scissors, curved shaped scissors or any surgical instruments we can keep in that container. Next, dressing materials. Dressing materials means cotton, gauze piece, like that. Okay. Next, BP apparatus. BP apparatus means sphygmomanometer for checking BP. Thermometer. Thermometer for checking body temperature. Next, sterilizer. To clean for sterilizing instruments we have to keep one sterilizer. Next, oxygen cylinder. If any emergency, if the patient is having any breathing difficulty, we can use oxygen. So we have to keep one oxygen cylinder in first aid room. Next, medical waste containers. Medical waste containers means in hospitals we can observe that different types of bins, green color, red color, blue color, white color. So we have to keep these types of waste containers in the room to throw the waste, different waste. Okay, next we will see the first aid kit. First aid kit means what, how it will helps, what it contains. Okay, first aid kit consists of items for providing first aid in case of bleeding, fractures, burns. So first aid kit consists items which will helpful in the case of bleeding. bleeding blood, in any blood discharge or fractures or burns, it contains following materials. What all are the materials we will see? First one, band-aids. For band-aids of all sizes. Okay, we have to keep all band-aids in all sizes for children's, elders, everyone's. Okay, next, gauze pads for cleaning wounds or cuts. Gauze pads for cleaning wounds, cuts. Gauze pads means it will be like a cotton only. Okay, next, dressing rolls, crepe bandage for covering injuries. So if the person is having any injury, we have to cover it with crepe bandage. Okay, we have to keep dressing rolls and crepe bandages in first aid kit. Next, medical tape. Okay, next, cotton balls. Next, safety pins for keeping that bandage side. Okay, next, antimicrobial hand wipes. Okay, antimicrobial hand wipes, hydrogen peroxide for cleaning wounds, ice pack, hot pack to relieving the pain, thermometer for checking temperature, scissors, sterile gloves. So while giving first aid, we have to wear the sterile gloves to prevent infection. Next, important medications to be kept in this kit, first aid kit, or first antibiotic ointment. Okay, we have to keep some antibiotic ointment and calamine lotion. Okay, for skin infections we will be using now that calamine lotion. Fever reducing medicines, example, paracetamol, dolo. So everyone knows that. Okay, we have to keep these tablets in first aid kit. Next, Advil. Okay, anti-inflammatory. This tablet used for antibiotic for reducing infection. Okay, next, Benadryl syrup. Everyone knows this syrup for cough relieving. Okay, for cough relieving we will use this Benadryl syrup. Next, ORS, oral rehydration salt. So if the person is having this vomitings or diarrhea, in that time we can use this oral rehydration salt. Okay, we have to keep these also in kit. Next, tourniquet bandage for compression bandage. Okay, we will call it is compression bandage for covering this to control the bleeding. Okay, next, splints means fracture cases. In fracture cases or any bone sprain is there, to support the limbs or anything, we will use these splints. Okay, we have to keep these things in first aid kit. Next, common drugs which we will use, or for headache we will use Soridon, aspirin. నెక్స్ట్, హార్ట్బర్న్ అండ్ అసిడిటీ. సో ఇవి ఉన్నప్పుడు మనం ఏం మెడిసిన్ యూజ్ చేయాలి అనేది మనం ఇప్పుడు చూస్తున్నాం. ఓకే, హార్ట్బర్న్, అసిడిటీ, డైజీన్ టాబ్లెట్ ఆర్ సిరప్. ఓకే, నాజల్ కంజెషన్ ఫర్ దట్ రిలీఫ్, నాజల్ డ్రాప్స్ ఆర్ విక్స్ వ్యాపోరబ్. నెక్స్ట్, ఫీవర్, ఫర్ రెడ్యూసింగ్ ఫీవర్ everyone knows this common tablet paracetamol and dolo. Okay, next, constipation, one powder. Okay, isbal husk with hot water or milk. Okay, we have to add it in water or milk and we have to drink. Next, pains and strains. Okay, tab, Flexon or Combiflab. Okay, these tablets we have to use. Okay, bone sprain. Okay, like that. Dehydration, for dehydration we have to use oral rehydration salt. Okay, this is the main important materials and medicines. We have to see that everything should be there in first aid kit. So this is the topic of today's. So definition, purpose and principles of first aid, rules of first aid, and facilities, equipments and materials for first aid and first aid room, and what is first aid kit, what it contains, some important general medicines we will use in our daily life. Okay, these are the things we have learned today. So be attent and concentrate on this topic and listen carefully. Okay, if you have any doubts you can post it in group. Okay, I will clarify. Thank you.